Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabert-Schuster, State Director of AARP in this territory. And again, it's a great pleasure for me to be here with you today. We wish you a very happy new year. We have gotten through the holidays now. I hope all of you remain safe and COVID-19 free. We hope that all of you remembered your social distancing and washing of your hands, etc., to keep yourself free and safe from COVID-19. Today, our show is dedicated to a very important topic now that we have mentioned COVID-19. And so we have with us some special guests from the Department of Health here in the Virgin Islands. We have with us Ms. Justa Encarnacion, the Commissioner of Health, Dr. Ty Hunt, the Chief Medical Officer of the Department of Health, and Ms. Monife Stout Caesar, the Territorial Director of Immunization of the Department of Health. Welcome, ladies. How are you today?
Well, thank you so much for having us.
Thank you. It's a pleasure. There are lots of questions in the community about the vaccine, and I'm glad that you all can be here with us today to answer some of those questions. So, Commissioner Encarnacion, I realize that you have a very busy schedule and you may be leaving the show momentarily, so I'll turn the mic over to you for any message you may have for our listening audience.
Well, first of all, really and truly, it is a pleasure. We've been trying to figure out ways in which we can touch bases with the senior community, and we have identified several different ways that we can. But I know Dr. Christensen reached out to you and your team, and we welcome the conversation that we're going to be having today. And so, Director Stout, as well as Dr. Ty Hunt Caesar, who's our medical director, will be speaking to you a little bit more about what we're doing. But I really and truly, one of the things that we want to say to you is that Department of Health is working very closely with our federal partners. We've started to work with them maybe 3 months ago, and we have been meeting with them on a daily basis. Department of Health and Human Services, the Center for Disease Control and Prevention, and of course, FEMA, who's underground with us, as well as CDC. And we're working with them in terms of Operation Warp Speed. And the topic of the day is, of course, vaccination linked to COVID-19. And everyone sees the number of cases that have been increasing in the mainland. What we realized several months ago, and we continue to see, the cases that increase in the mainland sometimes come to us. And we've been very well able to manage. And I think that's really and truly what public health is all about. And we spoke with the governor this morning and talking about the fact that we right now do not have any COVID positive patients in either of our hospitals. And it is because of the work that's being done throughout the territory to prevent that. From a health perspective, Dr. Ty Hunt Caesar and Dr. Donna Christensen and the work that we're doing in terms of mitigation, how we're speaking to the people, how we're linking with VIPD and Commissioner Delanour and tourism. We have such a great partnership with Commissioner Joe Bichelsi, and I say this a lot when I go, but I don't think people realize that health cannot do it by ourselves, and we have not been asked to do it by ourselves. We actually are doing it because of people that work together on a day-to-day basis in our epidemiology department, communicable disease. We could go on and on. Now, we finally got to the point where we have a medical countermeasure, being the vaccine. And Dr. Hunt Caesar is our medical lead, our healthcare lead for that initiative. And Director Stout, being the Director of Immunization, has been chosen to be the one who actually is more the voice for the vaccination. We started off with the flu vaccine. Now we're really into the COVID vaccine. We have been getting a tremendous outcry for the vaccinations. And I know that you're going to have a lot of questions. And Dr. Hunt Caesar is not just our medical director, she's also an expert in infectious diseases. And she's going to be able to break it down for you. And so what we want is that, and I say this to all agencies, all businesses, we're not here to force anyone or mandate anyone to get the vaccine. What we really want to do is for you to fully understand what the vaccine is all about, how it can actually protect you and protect the ones that right next to you, the ones that you love. And so that's kind of like why we're here today and why we're happy to be in the conversation with you.
Great. Thank you so much, Commissioner. And, you know, before you leave, I just want to express my gratitude to you and your entire department and all of the other key players from the time this terrible pandemic started afflicting us. You know, I realize that there are many people out there who complain and gripe and criticize and so forth, but I know that all of you have been working so hard and you all have been doing a great job, you know, protecting us against this enemy that we can't even see, right? I mean, how do we even work against what we can't even see? It's so difficult. But but yes, I mean, our numbers have been reasonable here in the Virgin Islands. You know, we can't expect miracles, but they've been very, very, very reasonable. And all of you have been doing a great job. So on behalf of AARP, on behalf of our entire membership, on behalf of the community, I thank all of you and continue to support you in the work going forward, because this is just really the beginning of the battle. We were hiding from the enemy before. Now the battle is here with the vaccines, right? So this is just the beginning.
And before I leave, let me link the vaccine to, and the reason why we have the vaccine is because of COVID-19. And we've been able to keep our numbers down because we're doing as many tests as we possibly can. And as soon as we find a positive, when we say you need to quarantine, we look at your contact traces and we have your family members or your close contacts actually quarantine as well. So what we're doing, for example, we're doing pop-up testing. We've changed our perspective in terms of how we connect with the community. So we're out there, we're on the ground, we're walking, we're talking, we're teaching, but we're also pop-up testing. So today at Kanagita Ballpark, we're testing from 10 to 1. In St. Thomas, we'll be providing free COVID testing through from January 13th, which is tomorrow, January 14th on Thursday from 1 p.m. to 3 p.m. in the Home Depot parking lot. And then we actually have testing on Wednesday, tomorrow, from 1:30 to 4:40 at the Vipa Gravel parking lot near the car ferry in St. John. So that is a balance. You have to do your vaccinations, or we encourage you to do your vaccination, but you still have to be tested. You still have to know what your COVID status is. And so I'm going to leave, but we have the experts here who's going to give you a wealth of information. And so I really wanted to thank you, Mr. Schuster, for having us on. We'll continue this communication, this link. We have the connection. We'll maintain that connection. And I wanted to say thank you. Absolutely. And of course, thank you to my team.
Yes, thank you for being with us. We'll be chatting again shortly. Thank you. Have a great day.
Thank you.
And so, Ms. Stout, the next question I will direct toward you. It may be that Dr. Hunt Caesar would like to answer, but given the initial limited supply of vaccines, AARP believes that policymakers should develop plans to distribute vaccines in a way that maximizes public health and safety, while prioritizing those at highest risk. How is the Department of Health determining an equitable distribution of the vaccines to the most vulnerable to contracting the virus?
Great question. And hello, everybody. Well, what we are doing is following with discretion, which we are allowed, the ACIP recommendations for vaccine distribution. When the emergency use agreement was signed by the FDA for both Moderna and Pfizer first, of course, the ACIP met and determined that very thing. How best can vaccines, or should vaccines, be distributed among the population with consideration of persons with medical conditions, age, reflective of what area of the population or segment of the population was being most affected. And it was something that was generated to help be used as a tool of guidance for all jurisdictions across the nation. With that said, each jurisdiction has the option to be flexible with that. Every jurisdiction is different. Every need within the jurisdiction is different, and it is for us in the U.S. Virgin Islands. So I met with Dr. Hunt Caesar, with Commissioner and other bodies within the department to determine how best do we do the same. So we kept some of those things, including our most senior population, persons with a disability, frontline staff, clinical staff, and then moving onward to other areas of the community where services could not be done at home. Not everybody can work at home. You have grocers, you have bankers, you have other areas in the community that are function in a respective way that does not enable them to be behind closed doors as the rest of us can and do things virtually. With that said, we generated our version, if you will, of vaccine recommendation, or our layout of what it's going to look like for us, our phases. So what was developed was a phase approach nationally: phase 1A, phase 1B, phase 1C, phase 2, and phase 3. Phase 3 being the wider public. Phase 2 being the wider public, yes, but with specific focus on certain populations. Phase 1C, phase 1B, phase 1A, and so forth. When we started vaccinating the week of December 14th, we focused on phase 1A, and that was pretty much unilaterally in conjunction with the ACIP recommendation because it made sense. We wanted to vaccinate first our clinical frontline staff. These are persons who worked in hospitals, healthcare centers, and the like, EMTs, persons on the medical front line, and also persons living in congregate facilities where assistance was needed, meaning long-term care facilities, nursing homes, and the like. And so when we started, that's where we began, and we're still in that process at the on the tail end of that process, because there are different requirements, especially for those residential facilities. They may need certain letters of approval for us to go in and vaccinate, okay, because they're under the supervision of either Department of Human Services or even Department of Health. So there's certain stipulations that we need to abide by. At the same time, we started phase 1B that kind of expanded a bit. Now you're looking at frontline emergency staff, fire service, you're looking at police officers, and down the list, all the way to grocers. And so that's the phase we're in now while we're closing out phase 1A. So to answer your question, yes, we are following ACIP recommendations, but at the same time, we're being flexible with what works best for the territory.
Great. And so keeping that in mind, do you have an idea of when the older population will be focused on? Because I know that, as you said, you're still going through 1A, 1B now. There's a bit of an overlap there.
Yes.
So I guess 1C will be that older population. And when will that focus and emphasis start up?
The older population has been from the beginning, because we have a large older population. And here's where we differentiate maybe from other states and territories. We have a larger population that requires we give them attention throughout each and every phase. And there's no hard start and stop with the phases. So they can flow one into another because it's a process.
Sure.
And there's no closed door per se. So our senior population will be served throughout. We may have started hardline on our clinical staff, which I mentioned before made perfect sense because this is exactly who we want to help first because they're helping us.
Absolutely.
Now, when we move on to the latter part of the phase, long-term care facilities, and here we are leaking into that population in question, we can now say 65 and older are going to be served throughout to the very end.
Okay, excellent. And so, Dr. Hunt, the Chief Medical Officer of the Department of Health, the rapid speed of development of this COVID-19 vaccine compared to other vaccines has raised many concerns among the wider public about the safety of the vaccine. That, coupled with a lot of sensationalism that we hear all over social media. I mean, wild and bizarre that they're going to put a microchip in the vaccine and inject it into us and all kinds of bizarre things. Please share with us, with the public, how the vaccine works, its safety, and its effectiveness in fighting this novel coronavirus. Dr. Hunt?
Excellent point, and thank you for having me and my colleagues on the show to talk to everyone about this important medical countermeasure. So, following what Commissioner Encarnacion began the show with, and with what Director Stout pointed out by including the most vulnerable populations, which includes our senior residents, is important to understand that this medical countermeasure is a safe and effective vaccine. So as you pointed out, there has been a lot of misinformation that has been published and pushed out through social media outlets that has really damaged our our uptake or an acceptance of the vaccine. So, as Commissioner Encarnacion said, we've been meeting with the federal partners for several months before the vaccine was even available to be distributed. And that was to ensure that, as a priority from the Department of Health, to ensure that the process of the vaccine development was actually being done in a safe and effective manner. Why was it done so quickly is a question that I commonly receive, and it's very easy to understand this. The reason why that a vaccine was developed at such a rapid pace was because of the alarmingly large or high amount of people who have been dying and continue to die from this disease. So the vaccine was attempted to be developed from the onset of the emergence of this infection very quickly. We have advanced over the years for vaccine development. Vaccines, I like to say the development of vaccines was one of the number one public health achievements, if not the most significant public health achievements in the 20th century. We are in the 21st century, and we have been studying viruses and vaccines for going on almost 100 years now. So we know exactly what to do and how to develop vaccines. Vaccines have been safely administered for the duration of the 20th century, and it continues to significantly impact and increase the length of life as well as the quality of life. So the coronavirus was studied, and it was found to have a very good immune response on the cellular level, and in the laboratory very early, using a strain or a protein from the virus, a messenger RNA protein that has been proven to be very effective at producing an antibody response that would be helpful for protecting someone who has been exposed and infected with the virus. So that once that was done, very quickly in the lab, we were able to advance very quickly to what we call the clinical trials in the different phases to determine the safety and efficacy in humans. And I, as a student of infectious diseases, who has been trained in this field and has actually participated and done vaccine research, I vetted this process step by step with my colleagues who I trained with on the mainland to ensure what was happening in each phase, and no phase and step was missed. It was that the data was collected in a very rapid manner so that we can advance as quickly as possible so that we can save lives. Every day in the United States of America, about 3,000 to 4,000 people die daily. It is incredible to still hear why was the vaccine developed so quickly, because we are trying to save lives. Yeah. The vaccine was specifically developed to save lives. Okay, that is what vaccines do. So the vaccine was studied in 5 jurisdictions nationwide, and we have the approval of 2 vaccines, Pfizer and Moderna, that has been shown to be 95% effective, meaning that in 95% of people that take the vaccine, you will mount or generate a response that will be protective for you. If you actually indeed get exposed and infected with the virus, you will not become hospitalized. You may not develop any symptoms at all, if not just very mild. And it was 100% effective at preventing death. And that is what the take-home message is that if you get infected with coronavirus, you can die. If you get vaccinated with the coronavirus vaccine, it will prevent you from dying. So vaccination save lives, and I am very excited that we have been included simultaneously with the remainder of the United States and all jurisdictions to receive this vaccination so that we, the people of the Virgin Islands, can be protected just as though everybody else is protected. And there is no difference in who should get the vaccine. So there should be no mistrust and no sort of idea that certain people will get the vaccine and it will be tested on certain people. That is not true. That is the phases and the clinical trials are done. The experiments are over, and now it's being distributed equitably to everyone. And I'm happy that we are enrolled and have the availability of the vaccine with the prioritization of our vulnerable patients, including our seniors, because I am most concerned about our seniors being hospitalized and unfortunately dying from the disease in the territory.
Right. Wow, excellent. You said a lot there, and I thank you for everything you said. And it's very encouraging to know that you tracked the development of this vaccine and that you have been involved in a previous part of your profession in the study and development of vaccines. And is it correct, is my understanding correct, that you are an infectious disease specialist also?
Yes, sir.
Excellent. Infectious disease specialist, and probably the only one in the Virgin Islands. So no, it's wonderful that you're there and part of this team and bringing this important information to us. And so, Dr. Hunt Caesar, before I move on to the next question, subsidiary one, as you mentioned, Pfizer and Moderna, is there any difference between those two, and is any one of them more effective than the other?
They are just about equal in efficacy. I don't recommend one over the other. The only difference in the vaccines is the way that it's handled and stored, and that is just for the vaccine providers to ensure that and ensure that that they are stored at the correct temperature. And the only minor difference is that the coronavirus vaccine for both Pfizer and Moderna, you will have to get a booster shot. And the Pfizer vaccine is recommended for a booster shot in 3 weeks, and the Moderna vaccine is recommended for a booster shot in 4 weeks. That is a very mild difference, and I don't recommend one over the other. I recommend you get whatever is available and get it as soon as possible.
Excellent, excellent. And so, Ms. Stout, states on the mainland are now facing challenges gaining access and distribution of the vaccine. What, if any, are the safeguards in place at our local Department of Health to ensure that Virgin Islanders have access to the vaccine? Because we have been hearing that maybe the supply chain has slowed down. Can you shed some light on that for us?
Yes, you are correct. There is an issue of supply versus demand, and that's a national issue, and we are not exempt from that. What we're asking is that persons make an appointment, first checking with their provider to see if they are participating in the COVID-19 vaccinating program, meaning see if they are receiving vaccines from the Department of Health as on a regular basis as part of the overarching push to get persons vaccinated. Then if not, to make an appointment by checking online, or we're going to be sending out notifications soon this week with further information. But there is a list available of all the providers who are vaccinating providers, and you can check and make an appointment with them to make sure that you are on that queue, you're online to get your vaccine. And with conversations with AARP, we're now looking at other ways we can further narrow that approach specifically for seniors, and we are definitely going to take that into serious consideration. Maybe mini mass vaccinations just for seniors, and that will be forthcoming as we get everything prepared for that and make sure everything is done properly. But in the interim, we do ask that persons make an appointment.
Excellent. Yes, and thank you for bringing up that AARP and the Virgin Islands Department of Health, that we have been having conversations about vaccination drives to make it more readily available and accessible to older people. So more to come on that. And Dr. Hunt, so one big question then, for those who have been vaccinated, do they still have to exercise precautions after they've been fully vaccinated, including that booster? And if they should practice precautions, what are those and why?
Wonderful, excellent question. The answer is yes. Okay, so when I tried to explain it before, remember the coronavirus vaccine once you get the vaccine, will allow your body to be ready to fight an infection if you are exposed and indeed infected. That means that if you get the coronavirus vaccine, you can still get coronavirus. It just means that you may not get the symptoms, and you definitely won't get hospitalized or die. But for the small amount of time where you might, be infected and your body is gearing up to fight it, you can still transmit the infection. So the answer to the question is yes. You need to continue to wear your mask. You need to continue to wash your hands. You need to continue to practice social distancing. In addition to all of these mitigation practices, the vaccine will add to that, to this response, and will be sort of like an additive effect, so that we can end the pandemic. You can still transmit the infection if you get the vaccine. The only thing that will allow us to stop wearing masks and stop with the social distancing is if we get the global burden of case diseases down. And that will eventually happen when we do have the amount of people immunized that we want to, which is with the 70 to 80% of the population. Once we achieve herd immunity, that means that the number of cases go down. So initially, even though you get the vaccine, you still have to practice the washing hands, the mask wearing, and social distancing, until we get eventually the amount of people immunized that we would like to. So yes, you have to keep it up. It all has to be used together so that we can end the pandemic eventually.
Excellent. Yes, that's very important for people to remember. So please, once you receive your vaccine, please do consider to practice social distancing, wear your masks, wash your hands. Don't just think that it's all over when you get the vaccine. We still have a battle ahead of us. Now, Ms. Stout, tell us how the public can learn more about the distribution. I understand that there's a list of even private healthcare providers out there, non-Department of Health. Can you tell our public where they can find all of that information and how they can go about seeking the vaccine?
Sure. COVID-19 USVI.com. And that is the website they can go to find all the information they need about where to find a vaccinating provider. It has links to other need-to-know snippets and clips and advisories on how to what to expect and what to do before and afterward. Everything that you need to know is on that website. So I ask not only AARP members, but their families as well, if they're listening and watching, to go online and get that information.
So again, that's COVID-19. Is that one word or is it hyphenated? How is that?
It's all together, COVID-19 USVI.com.
USVI.com. Okay, great. And I did take a look at that earlier, and I saw that there's a nice spreadsheet, a nice grid with all the different providers on St. Croix and on St. Thomas and St. John. So we encourage everybody to look at that. Well, we've come to the end of our show. There's still so much more to discuss, so we look forward to having you all back again and again as we continue fighting against COVID-19. But Dr. Hunt Caesar and Ms. Stout, thank you so much for being with us today.
Thank you for having us. It was wonderful.
Yes, thank you so much.
Our pleasure. We'll talk again soon. Bye-bye.
Bye-bye.